Hello, my name is Nicole Leons. I'm a USF graduate student, and I am getting my doctorate degree in as a nurse practitioner in psychiatric mental health. A little bit about me: I am a registered nurse. I've been a registered nurse for about 5 years. I love it. I started off in ICU, and then I'm now in psychiatric mental health, and I want to be able to show other providers, other clinicians, how to implement trauma-informed care in their practice in order to reduce harm. So I heard about this wonderful clinical immersion program, Study Abroad in Kenya, where I could receive clinical hours for my program through Dr. Goyle. Dr. Goyle is faculty here, and she's been going to Kenya every year for the past 7 years, and she loves it. The stories that she tells of the people, the work that she does there, it's life-changing. And what better way to learn about another culture, to learn about another medical system, to be immersed in a new way of life, and to take a look and see how does trauma impact people around the world. My big DMP project in Kenya, and to do research, I was able to talk to many of the nurses there that were working there, and I learned so much. And so so we're in the process of actually getting the data together and analyzing it, and it will be published. So I am really excited and looking forward to that. So I can't wait to share it with everyone. I hope that my published work will be able to open doors for more people to learn and to understand and to do more research in these other countries, and to perhaps be able to provide the necessary resources and help that they'll need to implement more trauma-informed care. Because it doesn't matter if you're rich, poor, if you live here in the United States, or if you live in a country in Africa like Kenya, it's everywhere. It may show up in different ways or forms. It could be molestation, it could be food insecurity, it could be homelessness, it could be war, it could be displacement. I hope that it opens doors for more research in these other countries and these other areas, and that we can collectively, as a whole, be able to create a trauma-informed care program that you have a holistic type of treatment for the patient, to be seen as a patient, acknowledged and validated, and to be able to ask the patient not what's wrong with you, but what happened to you, and look at how those past inferences can show up in adulthood. I learned that USF has one of the best nurse practitioner programs in the country, and I really wanted to get my doctorate. So I wanted to go from my BSN, which is my Bachelor's of Science in Nursing, to my doctorate, and USF had the ideal program. Not only did they have my program here, but I felt that the connections that I've made here within the program have been amazing. The people that I've met, very supportive. All of my instructors have been supported, especially Dr. Goyle, who put together the Study Abroad clinical immersion trip. She has been very supportive, and I thank her for that. And just being able to have those experiences, such as Kenya, and to be able to work with a team of wonderful professionals that I could bounce ideas off of. It has been an amazing experience, and I would recommend it for anybody who's looking into coming to California to take a look at USF, because their program, I could speak for the doctorate program for nurse practitioners, is amazing. What I would tell the next generation who has this opportunity: take it. It is once in a lifetime where you will be traveling around the world, seeing a totally different place, totally different country, being able to experience their medical care system, being able to work with incredible professionals, nurses from Kenya, that you will learn so much. And so I think that if you have this opportunity, definitely take it, because it'll change your whole life.